Welcome to the veterinary pharmacology session on MCQs on Unit 1. Professor N Purohit from GNP Sir Classes provides your 30 MCQs of assertion reason. Match the following in Statement I. Statement 2 types of MCQs commonly asked in JRF and other veterinary exams. Listen to the MCQ and the options and write down your correct answers. Professor Purohit provides the correct answer option and the explanation. Watch the video completely to learn the pattern of questions and memorize the answers. So here is the first MCQ. The assertion is that drugs administered by the intravenous IV route provide 100% bioavailability. Reason R. IV administration bypasses the first pass effect. The options I. Both A and R are true and R is the correct explanation for AB. Both A and R are true, but R is not the correct explanation for AC. A is true, but R is false. A is false, but R is true. The correct answer is option A. Explanation. IV administration directly introduces the drug into the systemic circulation, ensuring 100% bioavailability and bypassing the first pass effect. The question number 2 assertion, oral drug administration is unsuitable for emergencies. Reason, R. Oral drugs have a slower onset of action due to the absorption process. A. Both A and R are true, and R is the correct explanation for AB. Both A and R are true, but R is not the correct explanation for AC. A is true, but R is false. D. A is false, but R is true. Correct answer is option A. Explanation. Oral drugs require absorption through the GI tract, which delays their therapeutic effect, making them unsuitable for emergencies. Here's the question 3 assertion. A. Subcutaneous administration is unsuitable for irritant drugs. Reason, R. Subcutaneous tissue is richly supplied with nerves but less vascularized. A. Both A and R are true, and R is the correct explanation for AB. Both A and R are true, but R is not the correct explanation for AC. A is true, but R is false. D. A is false, but R is true. The correct answer is option A. Explanation. Irritant drugs can cause significant local pain and tissue damage in subcutaneous tissues due to their rich nerve supply. Question 4. Match the drug administration routes with their characteristics. Route characteristic. A. Intravenous, IV, 1. Depot preparation. B. Intramuscular 2. Rapid onset, emergency use. C. Oral 3. Avoids first pass metabolism. D. Sublingual 4. Risk of aspiratory pneumonia A, A2, B1, C4, D3. B. A3, B2, C1, D4C, A4, B3, C2, D1. D. A1, B4, C3, D2. Answer A. Explanation. IV is rapid, IM supports depot preparations, oral risks aspiration in poor technique, and sublingual bypasses first pass metabolism. 5. Match the following routes with their examples. Route example. A. Topical 1. Intraocular drops. B. Parenteral 2. Subcutaneous injection. C. Specialized 3. Transdermal patch. D. Local 4. Dusting powder A, A3, B2, C1, D4. B. A4, B3, C2, D1C, A1, B2, C3, D4. D. A4, B2, C3, D1. Correct answer, D. Explanation. Topical drugs include powders, parenteral involves injections, specialized routes include patches, and local application includes intraocular. 6. Statement I. Liposomes are used for targeted drug delivery. Statement 2. Liposomes can transport both lipophilic and hydrophilic drugs. A. Both statements are true. B. Both statements are false. C. Statement I is true, and statement 2 is false. D. Statement I is false, and statement 2 is true. Answer A. Explanation. Liposomes have a bilayer structure allowing them to encapsulate both lipophilic and hydrophilic drugs for targeted delivery. 7. Statement I. Drugs administered through the intramuscular route have a longer duration than IV drugs. Statement 2. The intramuscular route is unsuitable for oily suspensions. A. Both statements are true. B. Both statements are false. C. Statement I is true, and Statement 2 is false. D. Statement I is false, and Statement 2 is true. Correct answer, C. Explanation. IM drugs have a longer duration due to slower absorption, but the route is suitable for oily suspensions. 8. Which of the following is incorrect about intravenous drug administration? A. Quick onset of action. B. Requires sterile preparation. C. Suitable for depot preparations. D. Provides 100% bioavailability. Correct answer, C. Explanation. Depot preparations are not suitable for IV administration, they are better suited for IM or SC routes. 9. Which of the following is incorrect about oral drug administration? A. Suitable for large liquid volumes. B. Unpredictable absorption. C. Avoids first pass effect. D. Risk of superinfection with antibiotics. Answer, C. Explanation. Oral administration does not bypass the first pass effect. Drugs undergo metabolism in the liver or intestine. 10. What is the preferred site for epidural injections in cattle? A. Between second and third coccygeal vertebrae. B. Between first and second coccygeal vertebrae. C. Between lumbar vertebrae. D. Between thoracic vertebrae. Correct answer option is B. Explanation. The first and second coccygeal vertebrae are the standard sites for epidural injections in cattle and horses. 11. Which of the following is not an advantage of transdermal drug delivery systems, TDS? A. Bypasses first pass metabolism. B. Allows rapid onset of action. C. Useful for drugs with narrow therapeutic indices. D. Provides controlled drug release. Answer, B. Explanation. TDS is not known for rapid onset, its strength lies in controlled, prolonged release. 12. Assertion, A. Drugs administered via sublingual route bypass the first pass effect. Reason, R. The sublingual route involves absorption through the buccal mucosa, which directly enters systemic circulation. A. Both A and R are true, and R is the correct explanation for AB. Both A and R are true, but R is not the correct explanation for AC. A is true, but R is false. D. A is false, but R is true. The correct answer is option A. Explanation. Sublingual absorption avoids the digestive tract and liver, preventing the first pass effect. 13. Assertion, A. Intramuscular administration is ideal for highly viscous drug preparations. Reason, R. Skeletal muscles are richly supplied with blood vessels but less sensitive to irritation. A. Both A and R are true, and R is the correct explanation for AB. Both A and R are true, but R is not the correct explanation for AC. A is true, but R is false. D. A is false, but R is true. Correct answer is option B. Explanation. IM administration is suitable for oily or viscous drugs, but it's not primarily due to reduced sensitivity. 14. Match the following parenteral routes with their key features. Route key feature. A. Intravenous 1. Rich in nerve supply. B. Subcutaneous 2. Large absorption surface area. C. Intraperitoneal 3. Risk of puncturing organs. D. Intramuscular 4. Depot preparation suitable. A. A2, B1, C3, D4. B. A3, B2, C1, D4C, A1, B3, C4, D2. D. A4, B1, C3, D2. Correct answer is option A. Explanation. IV uses the bloodstream's absorption capacity, SC involves rich nerve supply, IP risks organ damage, and IM supports depot preparations. 15. Match the following routes with their associated advantages. Route advantage. A. Inhalation 1. Controlled drug release. B. Transdermal 2. Avoids hepatic first pass effect. C. Topical 3. Minimal systemic side effects. D. Oral 4. Safe and convenient. A. A2, B1, C4, D3. B. A1, B2, C3, D4C, A4, B2, C3, D1. D. A2, B4, C3, D1. Correct answer is option B. Explanation. Inhalation avoids the first pass effect, transdermal supports controlled release, topical has localized action, and oral is safe, convenient. 16. Statement I. Oral drug administration is suitable for drugs with extensive hepatic metabolism. Statement 2. Drugs that undergo the first pass effect are metabolized before reaching systemic circulation. A. Both statements are true. B. Both statements are false. C. Statement I is true, and statement 2 is false. D. Statement I is false, and statement 2 is true. The correct answer is the option D. Explanation. Drugs with extensive hepatic metabolism are poorly absorbed when administered orally due to the first pass effect. 17. Statement I. Epidural administration avoids puncturing the meninges. Statement 2. Epidural drugs are deposited into the subarachnoid space. A. Both statements are true. B. Both statements are false. C. Statement I is true, and statement 2 is false. D. Statement I is false, and statement 2 is true. The correct answer is the option C. Explanation. Epidural injections are placed in the epidural space, not the subarachnoid space, avoiding meninges penetration. 18. Which of the following is incorrect about inhalation route? A. It provides rapid onset for volatile drugs. B. Requires special devices like nebulizers. C. Ideal for large domestic animals. D. Suitable for respiratory tract diseases. The correct answer is the option C. Explanation. Inhalation is not convenient for large domestic animals due to difficulty in using inhalation devices. 19. Which of the following is incorrect about topical drug application? A. Inunction involves rubbing ointments on the skin. B. Sublingual drugs are applied on skin for absorption. C. Dusting involves fine powder application. D. Transdermal patches release drugs into systemic circulation. The correct answer is the option B. Explanation. Sublingual drugs are applied under the tongue, not on the skin. 20. Which of the following is a key disadvantage of the intraperitoneal (IP) route? A. Large surface area for absorption. B. Risk of chemical peritonitis. C. Suitable for small-sized animals. D. Allows administration of large volumes. The correct answer is the option B. Explanation. Irritant drugs can cause peritonitis when administered via the IP route. 21. Which route allows for moment-to-moment adjustment of drug effects? A. Oral. B. IVC, inhalation. D. Subcutaneous. The correct answer is the option C. Explanation. Inhalation provides real-time control of drug delivery and effects. 22. Which of the following drugs are least absorbed via oral administration? A. Lipophilic drugs. B. Highly polar drugs. C. Weak acids. D. Weak bases. The correct answer is B. Highly polar drugs. Explanation. Oral absorption of drugs depends on several factors, including their ability to cross cell membranes. Cell membranes are primarily composed of lipids, making it difficult for highly polar drugs to pass through. 23. What is a specialized device for needleless drug administration? A. Dermojet. B. Liposome. C. Nebulizer. D. Transdermal patch. The correct answer is the option A. Explanation. Dermojet uses a high-velocity jet for drug delivery without needles. 24. Which site is commonly used for subcutaneous injections in horses? A. Inner aspect of the thigh. B. Gluteal muscle. C. Middle third of the neck. D. Cephalic vein. The correct answer is the option C. Explanation. The middle third of the neck is a standard site for subcutaneous injections in horses. 25. Which of the following is not an advantage of the intramuscular (IM) route? A. Depot preparation suitability. B. Precise control of drug effects. C. Mild irritants can be administered. D. Suitable for wild animals. The correct answer is the option B. Explanation. IM administration does not provide precise control of drug effects compared to IV. 26. Assertion A. The inhalation route is suitable for delivering non-volatile substances. Reason R. Non-volatile substances remain largely unabsorbed and produce local effects on bronchiolar smooth muscles. A. Both A and R are true, and R is the correct explanation for AB. Both A and R are true, but R is not the correct explanation for AC. A is true, but R is false. D. A is false, but R is true. The correct answer is the option A. Explanation. Non-volatile substances, administered as aerosols, act locally on the respiratory tract without systemic absorption. 27. Match the following specialized routes with their primary use, route use. A. Intrathecal 1. Drug delivery into bone marrow. B. Intra-articular 2. Joint diseases. C. Intramedullary 3. Subarachnoid space. D. Intrauterine 4. Uterine infections A, A3, B2, C1, D4. B. A4, B3, C2, D1C, A2, B1, C4, D3. D. A1, B4, C3, D2. The correct answer is the option A. Explanation. Intrathecal is used for spinal drug delivery, intra-articular for joint diseases, intramedullary for bone marrow injections, and intrauterine for uterine infections. 28. Statement I. Parenteral administration is preferred in animals that are uncooperative or vomiting. Statement 2. Oral administration is effective for emergency drug delivery. A. Both statements are true. B. Both statements are false. C. Statement I is true, and Statement 2 is false. D. Statement I is false, and Statement 2 is true. The correct answer is the option C. Explanation. Parenteral routes bypass the digestive system, making them suitable for uncooperative or vomiting animals, while oral routes are not suitable for emergencies due to slow absorption. 29. Which of the following is incorrect about topical drug administration? A. Drugs with high lipid solubility are absorbed through the skin. B. Topical drugs have no risk of systemic absorption. C. Transdermal patches provide controlled systemic delivery. D. Topical drugs can be applied as dusting powders. The correct answer is the option B. Explanation. Topical drugs can sometimes result in systemic absorption, especially if they are highly lipid soluble or used with occlusive dressings. 30. Which of the following is not an advantage of oral drug administration? A. Safe and convenient. B. Suitable for gastrointestinal infections. C. Predictable absorption of all drugs. D. Large volumes of liquid can be administered. The correct answer is the option C. Explanation. Oral administration often has unpredictable absorption, influenced by food, gastric pH, and other key factors. Thanks for watching. Hope you enjoyed your journey with US. Share, like, comment, and subscribe GNP Sir Classes official channel.